Hey, what's up, everyone? Coach Link here from Missing Link Fitness LLC. Thank you for joining me today and happy 4th of July. Hey, if you haven't done it yet, go to my page and like and subscribe and hit the notification button to get more videos. I have other videos as well you can go on there and check out. Of course, on my channel, I take a holistic approach. There's plenty of information out there, so I'm adding more to that information as well. Some other good videos from other influencers or knowledgeable people. But anyway, this is my everyday life. I've started working out when I was 13 years old. Now in my 50s, and I've always taken as much as I could, taking a holistic approach with doing the dieting and also in the supplementation. So I'm kind of a geek when it comes to that. I love the science behind supplementation and also dieting and things like that. So, we got workout videos, of course, and things like that. But I get a lot of questions, for diet, for nutrition. But anyway, so I started diving into that, and so this is what I like to present you with. Okay, so we're going to get right to it. The one I wanted to talk about today was muscle cramps. This is a question I got the other day, and I've gotten it quite a few times, and I make recommendations on what supplements you can take. Also, this is informational purposes, just so you know. So I'd also say, if you need to, you can talk to your doctor. I recommend it. And so anything I might bring up to you, just in case if, they say they want to give you a medication and you kind of say, you know what, I'd like to take a holistic approach as much as I can. You can bring this up to question, with your doctor. Okay. So anyway, muscle cramps. Again, I get questions on this, and I got one the other day. So this made me want to bring this up and bring it to the attention. Muscle cramps. Ordinarily, a muscle contracts when it is used and stretches out when the motion is completed or another muscle moves into the opposite direction. If a muscle contracts with great intensity without stretching it out again, you feel the pain of a muscle cramp. All right, so I'm sure this is muscle cramps that happen, like, say, at nighttime. You can have them. I've seen them when people's working out and stuff. So many people right here experience muscle cramps during the night. This type of cramp generally affects the legs, especially the calf muscles and the feet. They occur more frequently in older adults than in younger people. Children sometimes experience a type of crampy muscle and leg pain, often called growing pains. So muscle cramping is often caused by an imbalance in the body's level of electrolytes. Okay, so you might be a little dehydrated, or you might be drinking a lot of water and you're kind of short on the electrolytes. Also, minerals such as potassium, calcium, and magnesium, which in turn can be due to illness or exercise. Also, with like hot weather. I've noticed that more like in hot weather with people getting cramps. I've gotten cramps, from working, like been working out or later, or something. Deficiency in vitamin E also may be involved. Another common cause is unaccustomed physical overexertion, overuse or strain, sitting, standing, or lying for a long time in one position. Anemia, the use of tobacco, inactivity, fibromyalgia. I may butcher up some of these words, but hey, just work with me here. Hormone imbalances, allergies, arthritis, and even osteosclerosis can also result in cramping, and as can dehydration, heat stroke, there you go, hypothyroidism, or varicose veins, or more rarely, the early stages, lateral sclerosis. That's ALS. Okay, just ease it up that way, or Lou Gehrig's disease. Some medications can cause muscle cramping. So if you're taking a muscle cramping, or taking a medication, can cause muscle cramping as a side effect. The use of diuretic drugs for high blood pressure or heart disorders may lead to electrolyte imbalances causing muscle cramps. People using statins to lower blood pressure, and those who take anti-osteoporosis medication such as Alendra, let's say Fosamax. Like I say, some of these words, I'm going to butcher them up. May also experience muscle cramps. Poor circulation also contributes to leg cramps. Unless otherwise specified, the dosages are recommended here are for adults. So for a child between the ages of 12 and 17, reduce the dose of 3/4 of the recommended amount. For a child between 6 and 12, use 1/2 of the recommended dose. And for a child under the age of 6, use 1/4 of the recommended amount. All right. So, again, you got, I've known some people with blood pressure medicine that they get on, and really one of the side effects they have is like retaining a lot of water too. But anyway, it causes like a hormonal imbalance, really screws them up, and they have to take some like potassium to get that, water balance in there. Excuse me. So we're going to look at the nutrients. Here's some supplementation you can use, taking a holistic approach. All right, this is just for information. Okay. Essential is calcium and magnesium. 1,500 milligrams daily of calcium, 750 milligrams and up daily of the magnesium. Deficiency are most often the cause of cramping in the legs and feet at night. Use chelate or citrate forms. All right. So anyway, I could be butchering up these words. Vitamin D, 400 IU daily, needed for calcium uptake. Vitamin E, 200 IU daily or 400 IU every other day. Improved circulation deficiency may cause leg cramps while standing or walking, especially good if cramping and related to varicose veins. Use a D alpha tocopherol form. So anyway, very important, malic acid and magnesium as directed on the label. Malic acid is involved in the production of energy in muscle cells. Magnesium is a cofactor in cellular energy production. Potassium, 99 milligrams daily, needed for proper calcium and magnesium metabolism, aids in relieving muscle cramps. Silica, I might be pronouncing that wrong there too. I've never really even heard of that one. That's directed on the label. Again, you can do some research by looking it up as well, which I do recommend that. So if you watch other channels and stuff and it tells you, like, take this or take that, I still say, you know what, that's fine. And there's some legitimate sources that's out there that does have a lot of helpful information, which I follow and I watch myself, but still, I'll still do some research. I'll look it up. I like to have just further research on it. So as directed on the label, supplies silicone, which aids in calcium absorption. Ultra Osteosynergy from American Biologics, not biology, as directed on the label, provides nutritional support for bone renewal. Vitamin B complex, B1 and B3, 50 milligrams of each major B vitamins 3 times daily with meals. Amounts of individual vitamins in a complex will vary. 50 milligrams 3 times daily with meals. That's on the B1. The B3, 50 milligrams 3 times daily with meals as well. For improved circulation and cellular function, enhances circulation and may aid in maintaining proper muscle tone, increases circulation, and also a caution, do not take niacin if you have a liver disorder, gout, or high blood pressure. All right, so take that under caution, niacin. Vitamin C with bioflavonoids, 3,000 to 6,000 milligrams daily, improves circulation. I take extra vitamin C also for like immune function. So if you're kind of in an environment where it's hot and cold, and that can have, like a negative effect on your immune system. Where you go a few days it's warm and all of a sudden the temperature drops and it gets really cold and you feel the sniffles and stuff, and that can kind of affect you a little bit there. But anyway, I always say, take extra vitamin C just to, if you're using emergency or, something like that, is using that for to help strengthen your immune system as much as you can too. That don't hurt. Also, the vitamin Bs, you can take those. You can get the B complex vitamins. Also take, let's say, like a multivitamin. So important. DMG. All right, this word is it's hard to pronounce, so I'm going to say DMG. As directed on label, improves tissue oxygenation. DMG from Food Science. Okay, that's a Vermont. So that's a company. So, but again, you can look into that. There's other reviews. CoQ10. 100 milligrams daily, improves heart function and circulation, lowers blood pressure. I use CoQ10 every day as well. Plus, coenzyme A from Coenzyme A Technologies, as directed on the label, improves the effectiveness of CoQ10. So you kind of add a little supplementation there. Again, I use the CoQ10. Let's see, lecithin granules or capsules. Again, I might not be pronouncing it right. 1 to 2 tablespoons 3 times daily before meals. 1,200 to 2,400 milligrams 3 times daily before meals. Reduces cholesterol levels. Multivitamin and mineral complex, as directed on label. All nutrients are necessary for healthy muscles. So, you want to take a multivitamin stuff anyway. Also, zinc, 50 milligrams daily. Do not exceed a total of 100 milligrams daily from all supplements. Needed for absorption or calcium of action. B vitamins use zinc, gluconate, longes, or OptiZinc for best absorption. Okay. So let's look at the herbals. There's some herbals on this list. Alfalfa, bayberry, blessed thistle, cayenne, dongqua, ecositium, like some of these I can't pronounce either there. Elderflower, elderberry extract, garlic, ginkgo biloba, and saffron are good for circulation. Now I heard about the cayenne, like the cayenne pepper. Matter of fact, I've heard of that the other day. A cayenne pepper can help with blood circulation. So if you can, if you're already doing that, hey, that's probably helping out a pretty good bit. But again, checking to see if you're still having some cramps. It might be affected, like if you sit for long periods of time too, or it's like if you're in a hot environment and you're not really taking in enough fluids, or if you are drinking, say you're drinking enough fluids, say like you do drink a lot of water, you're probably flushing out a lot of your vitamins, minerals, and say like electrolytes. So I wouldn't recommend just using sport drinks either. Okay. That's kind of fair to middling. All right. So it's like, if you're taking like a sports drink or something, you want to be conservative with it because you got the electrolytes in it, but there's also a lot of sugar content if you're not doing the zero sugar, and also sodium content. So it's like some salt. So at least I'd say go 1 part, say of the sports drink, 2 parts water or something, kind of diluted it just a little bit more. All right. So it also don't sit heavy on your stomach. So caution, do not take Enhencia. And again, I could be pronouncing that wrong. For longer than 3 months, it should not be used by people who are allergic to ragweed. Do not take ginkgo biloba if you have a bleeding disorder or are scheduled for surgery or a dental procedure. All right, meadowsweet, valerian, or and skullcap help to relieve muscle cramps. Rubbing lobelia extract on the affected area helps to relieve muscle cramps or muscle spasms. Taking valerian root at bedtime helps to relax the muscles. So recommendations: getting adequate calcium and vitamin D is important. You can get these from dairy products and or supplements. Eat alfalfa, brewer's yeast, plenty of dark green and leafy vegetables, of course, cornmeal and kelp. Caution on the brewer's yeast can cause an allergic reaction in some individuals. So start with a small amount at first and discontinue use if any allergic symptoms occur. Again, I recommend that as well. But if you kind of feel uneasy about it, you can just, I think you can leave that out. Drink plenty of fluids. To stave off dehydration, take a large glass of quality water, preferably steam distilled, to flush out toxins stored in the muscles every 3 hours throughout the day. Warm up before intense exercise and cool down and stretch afterward. All right, so don't do 45 minutes worth of stretching before an exercise because that can elongate your muscle. And if you ain't careful, then you wind up pulling a muscle. I've learned that myself. Used to think we do a lot of stretches before we go into an, using intensity, lift some weights. I wind up doing, I just warm up, a light warm up to get myself going. So I do a little bit of pre-exhaustion before. If I'm going to go in a little heavier weights, then that's what I do. I do like a little pre-exhaustion, some, and then go into it. But then I done got the muscles warmed up, like the ligaments, the tendons and stuff are warmed up as well. And then, get that blood flowing pretty well there too. But again, now the stretches, I'd say you can do the stretches afterward. I think that's better too. Rub pure unprocessed olive or flaxseed oil into your muscles before and after strenuous exercise. Add 25 drops of oil to a hot bath and soak. Canola oil is also good for this purpose. So I've never heard of those. So, something to look into there. Avoid overworking your muscles. You don't want to do that, overtraining. Be careful with that. Massage cramping muscles and use heat to relieve pain. Take a hot bath using mineral salts before bedtime to increase blood flow to the muscles. Before going to bed, gently stretch the muscles that tend to cramp during the night. So yeah, you want to do some soft stretching there. If you're on a diuretic medication for high blood pressure or heart disorder, be sure to take supplemental potassium daily. So yeah, that does help. Okay. Note, do not take supplemental potassium if you are taking a potassium-sparing diuretic. So you can discuss that with your doctor. Okay. If you have cramps during the day while you are active, consult your healthcare provider. Okay. Might be a little something deeper than that. It could be a sign of impaired circulation or osteosclerosis. If cramping occurs after walking and is relieved when you stop, suspect impaired circulation. All right. Considerations: using creatine. Actually, creatine monohydrate, a popular supplement with athletes and bodybuilders, may increase the likelihood of muscle cramps. I haven't heard that, but again, take that as a precaution. Using creatine along with cimetidine, tagamet. Again, I might be saying that wrong. I'm pretty sure I am. Also, using like ibuprofen and or diuretics can also cause kidney damage. Hydrotherapy, the therapeutic use of water, steam, and ice, massage therapy, manipulation of muscles and other soft tissue may be useful in controlling muscle cramps. So anyway, you can take that under consideration there. All right, let's see what else we got here. There is another, it's a drug, gabapentin. All right, that's one word. And again, I could be pronouncing that wrong. A drug that is used in the treatment of epilepsy and may be used for bipolar mood disorder by some doctors and under study for its ability to relieve muscle cramps. Oddly, however, documented side effects of this drug can include muscle ache or pain, in addition to blurred or double vision, dizziness, drowsiness, swelling of hands, feet, or lower legs, trembling or shaking, and unusual tiredness or weakness until the results are known. That's really, let's say, recommended that you steer clear of using that drug. I would too. Just try to stick with, if you can, just go on supplemental, trying to not go on any medication. So there you go. That's in a nutshell right there. So I hope that helps out. So I'm going to leave it right there. But anyway, we're talking about muscle cramps. Again, I use like different supplements like the CoQ10, the vitamin C. I do use the magnesium. I use the magnesium also as a recovery agent. I do take extra potassium, especially if you're on a diet. Okay, so if you're like in a diet to cut weight, you might want to consider, you're taking a little bit of extra vitamin there. Also, like with a multivitamin, just to kind of cover your bases. Drink plenty of water anyway. But again, you can tell, it's like just checking out your electrolyte balance and stuff too there. So anyway, so I'm going to leave that right there. So I hope that helps out a lot. So you can use that on a daily basis. So until the next time, stay tuned. Like I said, hit the like and subscribe and the notification button so you can get some notices when I post up another video. Also, check out my podcast on Spotify as well, and my website. And also, you can follow me on Facebook, Missing Link Fitness LLC, and also on Instagram. All right, and my website is missinglinkfitnessllc.com. So, have a great 4th and stay healthy, and I will talk to you soon.